How do we measure hypermobility? Hi Liberty family, this month is Ehlers-Danlos Awareness Month, and today I'd like to share with you how your physical therapist may measure hyperflexibility or hypermobility. We often use a 5-item grading scale called the Baton scale to help us identify whether or not hypermobility or hyperflexibility may be present.
So the first part of the test looks at how much extension occurs in the pinky. So for me, I get about 50 degrees of extension. That wouldn't be a point. But for pinky extension, that's 90 degrees or more. That's 1 point for each hand. The next test item looks at whether or not the thumb can passively be pulled back to touch the forearm. If the thumb comes in contact with the forearm, this would be 1 point for each hand. For me, I can't make contact with my forearm, so that's not a point. The next test item looks at how much extension occurs in the elbow. So here, 180 degrees is considered normal, so no points. But if there's 10 degrees of hyperextension, this would be 1 point for each arm that hyperextends. The next test item looks at how much extension or hyperextension occurs in the knees. So here, normal is considered about 180. I've got a little bit of extra extension, but a positive would be 10 degrees hyperextension, and that would be 1 point for each leg. The final test item looks at trunk and hamstring flexibility. If you can bend forward and place your palms flat on the ground without bending your knees, that's 1 point. It's important to note that the knees cannot bend and the palm must be flat on the ground in order for this to count as a point.
The Baton score alone is not used to diagnose EDS, but it does play an important role in identifying hypermobility or hyperflexibility, which is a component of EDS. The total score is out of 9 points, but a cutoff of 4 is typically used to identify hypermobility. Make sure to tune in this week as we continue to provide information on management of Ehlers-Danlos, and make sure to come back on Friday where Dr. Rebecca Cantu will be producing a webinar on all things Ehlers-Danlos. Until then, move well, feel well, be well.